We'll be presenting at ASH the interim results of a phase 1/2 study of the combination of Ponatinib, Venetoclax, and Dexamethasone in patients with relapsed refractory Philadelphia chromosome positive ALL. And so this is a population of patients that have very poor outcomes, even in the modern TKI era. We know that Ponatinib is effective in this setting, but the duration of response historically has been very short, with a 1-year progression-free survival of only 8% in the large PACE study. And so there's preclinical rationale for the combination of Venetoclax with Ponatinib. There's data to suggest that there's a synergy between these two drugs, and also that potentially the addition of Ponatinib to Venetoclax prevents upregulation of MCL1, which is a known resistance mechanism to Venetoclax. So that was the rationale for this study design. We're reporting the phase 1 data at ASH this year. Essentially, the study is an entirely oral regimen of these 3 drugs. Patients initially receive a lead-in of 7 days of Ponatinib, and then starting on day 8, they receive combination therapy with Ponatinib, Venetoclax, and Dexamethasone, which is given for 4 days. The other drugs are continuous. And we give a standard intrathecal chemotherapy and then rituximab for patients who are CD20 positive. We are reporting 9 patients in the phase 1 study. So far, the regimen has been quite safe. There has been some myelosuppression seen with Venetoclax as expected, but this has been very manageable with dose interruptions as needed. And so, importantly, the outcomes seem quite favorable, particularly for the higher dose of Venetoclax. So we evaluated a dose of Venetoclax initially in the first patients of 400 milligrams, and then increased that to 800 milligrams. So 3 patients received the lower dose of Venetoclax, and 6 patients received the higher dose. So of the 6 patients who received the higher dose, 5 out of 6 achieved a response. Interestingly, of the 3 who received the lower dose, none responded. So this suggested that there might be a dose-dependent relationship of Venetoclax and this combination in terms of responses. So overall, 5 of the 9 patients have responded. Most of those patients have achieved a complete molecular response. So this suggests that these are very deep responses. And of the 5 responders, none have relapsed as of the last follow-up. So again, these appear to be rather durable. So we're very encouraged by the preliminary efficacy of this combination. The study is now enrolling into the phase 2 portion of the study. And so this is now with the 800 milligrams of Venetoclax, which we'll use for phase 2 in combination with Ponatinib and Dexamethasone.